Hello everyone, welcome back to Med-Surg Knowledge Nuggets, where we take big nursing topics and break them down into manageable, test-friendly content. Today we're talking about Alzheimer's. So Alzheimer's disease is a common type of dementia where the brain function gradually declines. We don't know yet what the exact cause is, but what we do know is that certain neurotransmitters, especially acetylcholine, decrease over time. This disease progresses over years, sometimes up to 20, and sadly leads to complications from immobility and organ failure rather than the disease itself. Family history is a key risk factor, so it's important for nurses to understand the genetics and progression to plan care effectively. Moving on to clinical manifestations. So early on, forgetfulness is the hallmark symptom. Patients may misplace items or forget recent conversations. As the disease progresses, short-term memory worsens, making it hard to manage finances or take medication safely. Later stages bring more serious cognitive decline, like difficulty with complex tasks, word-finding problems, and changes in personality. You might see patients who become socially withdrawn or even aggressive. As nurses, it's crucial to monitor these changes closely because they directly impact how we support a patient's independence and safety. This image just shows a depiction of Alzheimer's disease signs and symptoms. Diagnosis and treatment. There is no single test for Alzheimer's. Diagnosis is mainly clinical, based on history and ruling out other causes. Definitive diagnosis happens post-mortem. While there's no cure, medications like cholinesterase inhibitors help to slow symptoms by boosting acetylcholine in the brain. Our role as nurses includes ensuring medication adherence and monitoring for side effects while providing emotional support to patients and families, coping with the uncertainty of this progressive illness. So we're moving on to nursing assessments and interventions. Let's focus on what we assess and do day to day. So we're going to monitor weight and intake because patients often forget to eat or drink, putting them at risk for dehydration and malnutrition. We're going to check skin integrity since immobility and incontinence increase the risk of pressure injuries. We want to observe bowel and bladder function and implement toileting routines to manage incontinence. We're going to ensure the environment is safe. We're going to remove trip hazards, keep the beds in their lowest position, install grab bars to prevent falls since wandering and poor judgment are common. We want to encourage physical activity and social engagement to maintain function and to reduce agitation. For example, if you notice a patient becoming restless, a calm voice and distraction techniques can help reduce anxiety without escalating their behavior. Teaching families about these interventions is just as important as applying them ourselves. Family education is vital, so caregivers need guidance on medication management, creating a safe home environment, and recognizing when to seek emergency help. Labeling dangerous items and using monitoring systems can prevent accidents. Support groups and social services referrals also help ease the emotional and financial burden of care. As nurses, we act both as advocates and educators to empower families facing this challenging disease. And finally, evaluating our care means looking beyond physical symptoms. So patient safety, quality of life, and preserving dignity are also our priorities. Alzheimer's affects the whole family, so involving them in care, planning, and decisions, especially end of life, is essential. As nurses, our focus is on holistic care, so addressing physical needs, but also providing emotional support and ensuring a safe, compassionate environment throughout the disease course. Final nugget on Alzheimer's disease. So Alzheimer's disease is a progressive cognitive decline that requires nurses to balance safety, compassion, and education. Early recognition of symptoms and ongoing support for both patients and their families are key. As a nurse, your role goes beyond physical care. You're an advocate, educator, and emotional anchor, helping to maintain dignity and quality of life through every stage of this challenging journey. Thanks for watching. If this helped clarify things for you, make sure to like, comment, and subscribe for more Med-Surg knowledge nuggets just like this one. See you in the next video.